Hello everybody, I'm Dr. Senthil Kamalasekaran, Senior Consultant Orthopaedic Surgeon at Chennai Ortho Clinic, and today I'm going to talk to you about a very common topic, stress fractures. We will talk about what are stress fractures, who get them, how to diagnose it, and how to treat it. One of my friends actually sustained a very subtle injury to his foot and was walking with it for a very long period until he came to me saying that he had swelling in his leg and inability to walk. I had a look at his x-rays, but I couldn't find anything. The only thing running in my mind was stress fractures. Stress fracture is nothing but fatigue fractures. It comes because of overuse. It comes in athletes, it comes in military recruits, it comes in people who are involved in extreme sporting activities, and sometimes in elderly people because of weak bones. A hormonal imbalance in many people can actually tilt the favor in favor of bone resorption rather than bone formation, and can lead to a weak bone which can break with very trivial pressure. Which all bones can get affected? Any bone, but mainly the weight-bearing bones like the tibia or the leg bone or the foot bones. So we have the metatarsals in the foot which can get broken very easily. So sometimes when people do march past in soldiers, they can get a break in these things because of very severe, forceful marching, and they used to be called as march fractures. Now, how do you diagnose these things? We have to investigate the part which has been injured. So as I said, mostly it can be involving the lower limb like the neck of femur, the leg, the foot. It can also affect the spine, especially in gymnasts. It can also affect the shoulder and other parts in people who are involved in active throwing sports. So we take plain x-rays first to diagnose it. If we can't find out the problem, then we go for scans. There are different types of scans to find out the area of fracture, like bone scans or CT scans. However, the most specific diagnostic tool for us is an MRI scan, which can pick up even very subtle changes in the bone quality for us to diagnose a stress fracture. The treatment for this can vary. The most important thing for the person or the athlete is to rest the part. If you rest the part adequately for say about 6 to 8 weeks, the fractures usually heal. However, a chronic stress fracture or a fracture which has been displaced or a fracture in the region of the hip will need to be fixed. And though you fix your fracture, you should also make sure that you do not have any metabolic problems, and you should treat the metabolic problems. Like if you're having a calcium deficiency, vitamin D deficiency, all those deficiencies need to be addressed. And once you do that, then you can treat your stress fracture very easily. I hope this short video gave you some insight into what stress fractures are about. If you like this topic, please do like, share and subscribe. Thanks.